This is our presentation for hypertension. Just to start off and introduce my team members, we have Ember, we have Emma, me, Lewis, and then we have Ali. And next slide, please. Just to introduce a little bit of our topic, hypertension is high blood pressure. It's usually when the blood vessels are too high. This is a rough number of 140 over 90 for blood pressure. It is common but can be serious if it's not treated. Why is it important? It is important because high blood pressure increases the risk of heart attack, stroke, and other serious health problems. Nearly 47% of the US adults in the US have high blood pressure. This was found by the American Heart Association. Just to continue and to break down, there's two types of hypertension. One gets worse gradually over time, and the other one has an underlying medical cause. The treatment for the first one usually just focuses on lifestyle modifications. The second one is more like surgery wise and removing a tumor. Next slide, please. And then just to give a little purpose of our presentation, we chose the topic of hypertension because it is often called the silent killer, affecting millions and serving as a leading risk factor for stroke and heart disease. For OT, it represents a critical challenge that stakes are high. Uncontrolled hypertension does not just cause damage to the organs, it directly impedes the ability, to engage in occupations from managing health, work, participation, and leisure activities like painting. Next slide. And then as we can see here, figure one, we have our fake client that we made up. Next slide. And then just to give a little bit of background, our patient is 45-year-old male, Hispanic. He's a police officer. He's overweight by the BMI. He's over the 20s. He acknowledges having high levels of stress due to his demanding job. He has a family history of type 2 diabetes and admits not seeing a primary care physician regularly. Next slide, please. Just to start off with the case, while on patrol, Officer X was involved in a high-speed vehicle chase, was culminated in a foot chase. For the perpetrator, during the strenuous physical activity, he experienced a sudden sharp pain in his chest and was forced to stop. He sought immediate attention right after. Next slide, please. In the medical diagnosis, after evaluation, it was determined that the officer suffered a minor ischemic stroke, which directly attributed to his undiagnosed and uncontrolled severe hypertension. He is now formally diagnosed with hypertension stage 2. And then due to the cause of the stroke, he has minor fine motor skill problems. The patient struggles to engage in his passion of painting, sculpting, and crafting. Next slide, please.
So now for the anatomy, hypertension primarily affects two major structures, the arteries and the heart. First, the pressure inside the arteries rises, which puts mechanical stress on the vessel walls. Over time, this persistent stress injures the inner lining of the arteries and endothelium. Once that lining is damaged, the arteries respond by becoming thicker and stiffer, a process called vascular remodeling. These stiffer arteries create more resistance, so the heart has to pump harder to move blood through the system. Eventually, the left ventricle enlarges, a condition called left ventricular hypertrophy. This is the body's attempt to compensate, but it increases the risk of heart failure and stroke. In figure 2, this image shows the increased size in the vessel walls. For the physiology, hypertension develops through a cycle of damage and compensation. When blood pressure stays high over time, the constant force against the arterial walls injures the endothelial lining. This triggers inflammation and thickening, which makes the arteries narrower and less flexible. Because the arteries can't expand easily, blood pressure rises even further. In primary hypertension, this process happens gradually and without a clear single cause. It's influenced by genetics, lifestyle, and aging. Secondary hypertension, on the other hand, has a specific underlying cause, such as kidney disease, hormonal disorders, or medications. In both cases, the end result is the same: increased resistance, increased cardiac workload, and increased risk of cardiovascular events. For the diagnosis, blood pressure is diagnosed using standardized categories. Normal is generally considered around 120 over 80. Elevated blood pressure starts when the systolic number is between 120 and 129 and the diastolic stays under 80. Stage 1 hypertension begins at 130 systolic or 80 diastolic. Stage 2, which is more serious, is diagnosed at 140 systolic or 90 diastolic or higher. It's important to note that one reading is not enough for the diagnosis. Clinicians rely on multiple readings taken on different days or sometimes ambulatory 24-hour monitoring to ensure accuracy. This reduces the risk of diagnosing hypertension based on stress, anxiety, or temporary spikes. For the treatment, medical treatment for hypertension includes both lifestyle strategies and medications. Lifestyle changes address modifiable factors, things like improving diet, increasing physical activity, weight reduction, and managing stress can significantly lower blood pressure. Medication is used when lifestyle alone isn't enough or when blood pressure is in more severe ranges. Common medications include ACE inhibitors, which relax blood vessels, diuretics, which reduce fluid volume, and calcium channel blockers, which help the arteries stay relaxed. In secondary hypertension, the priority is treating the underlying cause. For example, removing a tumor, adjusting medications, or treating sleep apnea. Regarding Regardless of type, controlling blood pressure is essential to reduce the risk of stroke, heart attack, and long-term organ damage.
So next is the impact on the ability to engage in occupation. Earlier we discussed that the stroke did impact his fine motor skills, which ultimately affects the client's ability to participate in meaningful occupations. This can in fact affect many different occupations, and I'm going to discuss the ones that are impacted the most. The first one is the ADLs, which would mainly be related to bathing and showering, toileting and toilet hygiene, dressing, feeding, and personal hygiene and grooming. For this, he may have difficulties with gripping, manipulating, and holding objects while completing these tasks. Next is IADLs, and this can include communication management, meal preparation, and cleanup and shopping. For this, it would be like communication, typing using his phone, and then cooking recipes, then cleaning up after himself, and shopping for food, drinks, clothes, and other household items. Next, for health management, this would mainly include physical activity. For this, he just may not be able to complete certain exercises that he used to be able to do. For rest and sleep, this includes sleep preparation. He may have trouble with the grooming and getting undressed for the night. For work, this would be job performance and maintenance. And for this, he may have troubles with some of his tasks as a police officer. This could include like holding his weapon, handcuffs, and then also documenting reports. For leisure, this would be leisure participation, and this would mainly impact the ability to paint, sculpt, and craft, which were all leisure activities that he finds joy in completing. This would be difficult for him due to a lack of fine motor skills and not being able to really grip, manipulate, and hold these objects during the activity. This also would increase the difficulty of creating legible shapes and drawings since it involves precise hand movements and coordination. And then next we have figure 3, which just kind of discusses some of the symptoms that can be shown with hypertension if any symptoms are shown. So these include dizziness, blurry vision, nosebleeds, headaches, chest pain, blood and urine, shortness of breath, vomiting, nausea, or palpitations. Next, we have occupations changing with disease progression. So for this, hypertension is a risk for hypertensive heart disease. This can happen due to increased hemodynamic stress on the heart, and with time, it can lead to the left ventricle of the heart to hypertrophy and have to compensate for the load, ultimately leading to heart failure or other conditions, which could include kidney disease, heart valve disease, or aortic ulcers. It's also important to note that the patient is overweight, which can be another risk factor for developing hypertensive heart disease. For further restrictions, this is mainly as the disease progresses, it can result in a further decline and may require adaptations in assistant with specifically ADLs. And if he is unable to independently complete these tasks, it may require him to alter his routines and patterns. And it may introduce the idea of having to have help from others or adaptive equipment. It can also lead to additional hospitalization, which may lead to having less time for him to do the things that he enjoys doing. Lastly, it can also restrict the cognitive areas in his brain, and overall create a decline. Hypertension can impact brain health and cognition in significant ways. It can alter the ability to think, remember, and reason, which can have a negative impact on his everyday life in several ways, including social participation, work, and self-care tasks.
So when thinking about what adaptive techniques and interventions to utilize for the client, they must also align with his client-centered goals. So he understands that he'll have to make lifestyle modifications to prevent another CVA occurrence. In particular, he would like to focus on making changes to his current diet, exercise, and stress management. This way, he'll be able to work without being overly stressed, which is important for him. To maintain his blood pressure, the client will also have to take certain medications and on a routine basis. Additionally, the client would like to return to both leisure and work participation. So the client is currently experiencing slight tremors and reduced dominant right hand dexterity. So therefore, the client would like to improve their fine motor skills to participate in his occupations of painting, sculpting, and crafting. And then, so there are three types of occupational therapy interventions that would be best to consider: occupations and activities, interventions to support occupations, and applying education and training. So within occupations and activities, the OT can apply energy conservation techniques for both ADLs and IADLs. Modifications of these activities could also occur by adding in rest breaks between tasks to not exert too much energy at once to then work towards activity tolerance. As for interventions to support occupations, the OT can help choose an appropriate home blood pressure monitor. There should also be a targeted blood pressure to maintain, so therefore having a validated machine can produce the same results as it would in the clinic, which is important to ensure client safety management at home. And then another one would be education and training to promote health literacy regarding his diet, exercise, and medication management. So this would be educating on nutrition information, appropriate exercises that could correlate later on to what a foot chase would be in his job, and then also educating on his medications, what they do, and training on a routine for a consistent time frame. So because his lifestyle modifications and medication management are most pressing at this time, that would be the OT's primary focus as a first line recommendation to maintain a healthy blood pressure. So physical activity is important for the client to fully participate in his job. Starting with a routine of going for walks for 30 minutes per day can help reduce blood pressure risk and also lower stress levels by letting him out of his high stress work situations. Educating on healthy eating. The OT could introduce the DASH diet to align with this. And having access to health literacy on blood pressure is vital to one's management. Utilizing digital tools such as the mobile app to display reminders. It could also help with keeping track of his weight since he is in a higher BMI to indicate he's overweight. So this is justified as a client-centered intervention because in order to promote health management within the client, he will need to develop self-management skills. So the OT will assist in health literacy to set habits that will form a routine. And then to conclude, we have hypertension causes blood flow in restriction. Oh, Thank you. Hypertension causes blood flow restriction, and the arteries regulate blood pressure. So if the interior wall is enlarged, there's more force that's required to push blood through them. The occupational impact would mostly be on his ADLs currently, and moreover, throughout the progression of his diagnosis, if it's left untreated. And the OT's role is his most pressing goal, and it's of implementing lifestyle modifications such as diet, exercise, and medication management. And then next would be our references.